Welcome to the Take 1.5 podcast. This is your host, Min Lee. If you're anything like me, as a Korean American with a traditional immigrant parents, the word boundary setting is very confusing and hard to understand. It sounds harsh, it sounds selfish. So just to even think about setting a boundary gives me that guilty feeling. So today I invited Dr. Cho, who will help us understand what boundary is and give us some practical tools so that we could have a healthy boundary setting around us. Welcome, Dr. Cho. Would you introduce
Thank
yourself?
you. Okay, well, hi everyone. My name's Jang Cho. I am a child and adolescent psychiatrist and a 1.5 generation Asian American, Korean American, and a mom and a wife. And I'm so happy to be here today.
Thank you. We're glad you're here. So we have lots of questions because, like I said in the opening, boundary just sounds so scary. Like the word boundary, every time that comes up, most people are like, yeah. It's so hopefully today we'll be able to have more clear idea of what it is and how we could practice in our daily life with ourselves, with our family and loved ones, and also professionally.
Yeah.
All right, great. So first of all, why don't you tell us what boundary is? What does it really mean?
So, I mean, I think you hit it on many different points about boundaries being related to or associated with feelings of guilt and feeling like selfish and like also if I may add, you're being a 미국 사람, right? If you set your boundaries and. Yeah, and this is a word that has been coming and going around, especially these days. But I think for me, boundary is basically a fence around what I can fence around myself, and it's a protection for myself. That I have to put around for me to stay healthy and live my life the way that fulfills me. So that's kind of I think about boundaries. I think when people talk about boundaries, people think it's something that people do to feel, say no to other people or kind of it be not as considerate maybe within our family system, but I don't necessarily think of it that way. I think it's a system that everybody has in order to have a healthy relationship with myself, but with everybody else around me, including my family members.
To protect ourselves. Can I see it as a boundary, as a self-respect?
Yes. So self-respect for sure, but also respect for others, right? When you're respecting other people's boundaries, and even with parents or my child, or especially with my partner, I think it's very important to not only know what their boundaries are, but also I think this is the most important thing, where my boundaries are. Well, do I have a boundary? Where my boundaries are, and like recognizing when my boundaries are violated. Because a lot of times when I meet with my patients who are, especially my therapy patients are mostly Asian Americans, 1.5 and second generation a lot of times, and they talk about, well, I don't know what you mean, what boundaries, like we're not supposed to have them, right? Everybody does. Everybody has boundaries. You just don't recognize it as it is. And so we have to figure out where they are. Do we have to move forward a little bit, move the fence back a little bit? So these are the things that we talk about in terms of boundaries.
So does the fence fluctuate? Is it flexible? Move back and
Yes.
forth? Oh,
Yes, yes. So I think of it as like, well, it can be back and forth, or I think of it as like a little bit porous
okay.
sometimes,
Okay.
right?
Uh-huh.
There and boundary isn't just one boundary. You have so many different boundaries in terms of different aspects of your life, right? So you can have different boundaries for different people too, right? Like you're not gonna treat someone at work as the same as your best friend. So you may have a different boundaries towards each of the person in your world.
I see. I see. So it's not rigid. It's porous and flexible.
Yes.
So can you give us an example of what that looks like? What does that look like?
Well, let's see. I mean, I think maybe let's take a good example of like our children. So there, I have now almost 8-year-old, and she's maybe like she wants to like play with me all the time, right? And sometimes it's and I have a very flexible boundary for my child. Obviously, most moms do, but there's a point where there are things that I have to do in order to take good care of myself. So, for example, my daughter wakes up at 5 in the morning every morning.
Oh, okay.
Yes, it's hard, and I'm a morning person, so I'm with her pretty well, but my husband is not, and so he'll wake up, but he's kind of dazed and confused for a while. So he has learned to teach my child, like, Daddy will have to have 2 cups of coffee before I start talking to you.
Okay.
Right? And of course she doesn't like it. But and there are times where he's drinking his coffee and she starts talking to him and like she wants to engage with him, play with him, and he will say, "This is my first cup." Right? And then she'll be like, "Okay." Okay. So she'll wait until the second cup. That's a very small but also very interesting example of boundary, right? Because if you take a snapshot of that moment where he's like, "I'm only on my first cup," he's a bad dad, man. Like, she wants to play with you, and you're saying like, "Oh, you need time for your coffee,"
Yeah,
right?
just wait kind of thing. Yeah.
But if you think about it in a long term, like this is, for example, like if he continuously engages with my daughter when he's so tired, he's not going to engage as well as he would like, or she would like. So it's not a very fun time for either of them. Also, the goal is to have this relationship where they have this positive relationship with each other for long term, like for, I mean, I don't know, 10, 20, 50, 60 years with our daughter. Then what can I do that it's gonna make me in a good position, in a happy position to be able to engage with her, instead of thinking about like I'm gonna feel resentment about waking up so early and having to play with my child, instead of like, oh, I get to have my coffee and I feel good, I get to play with my child. So that's a boundary. Like he needs his 2 cups of coffee in order to be that way.
I have so many questions that's coming to my mind. So I think the first key word that you used was long term. Because we're quick to say, okay, well, okay, I'll just
Just
like,
one time.
just one
right?
time. Like I'll
Yeah.
put myself for my child. I'll sacrifice this time. But then you said for the long term, what works for the both of us, my child and myself. Because many parents would just fall into that, okay, just, all right, so what do you want to do now? Like very grudgingly. So that kind of builds up and it kind of, it's blurred. But so in the long term, that may not work the best. It may work, but it may not be the best solution to this. So why is it so hard for us Asian Americans to understand boundaries and also to set boundaries?
Well, I think before I answer that question, I think one of the things that I on purpose had an example of my daughter, because it's hard to make an example of like a relationship between myself and my parents, or myself with my in-laws, or you know, when you look at your elderly, I think that's where the problem issues come more so, right? Like when your elderly mother, your elderly Korean mother, requests certain things or demands certain things, and it's not what you would like, but kind of like how you said, like, you know, this one time, or 요번 한 번만, I'll bend backwards, whatever. And so I think the boundary becomes an issue because when you kept on doing all those exceptions, well, number one, you already know that's when you say this one time, that is going against your boundary, right? You're violating your boundary. And how many times of this 한 번만, that one time will you do, and this becomes norm, right?
Right.
And so how do you justify that? Because you're going to have a hard time coming to terms with the fact that you're having to not respect yourself every time you have to do certain things with your family. I think in Korean American families, or Korean families, or even Asian families in general, I think boundaries are really hard because we are more collective people, right? And so I think it's all about, like, Koreans do have boundaries just as a family. Right? Not individually. And
Okay.
right? And so and especially when I think in an immigrant family, it's much more so, because when you move here, you have to stick together, right? In order to survive those first years of immigration, and that's really hard. And so it's all about togetherness. And you think about goals as a together. So you're one entity. Then, like I said, the long-term goals are different, right? We're not talking about relationship between parents. It's about the whole family moving forward. So the boundary between the people inside the family isn't as important. So that's kind of how I think about why it's so difficult to even people, for my patients to identify if they ever had boundaries, right? Because it was never, not only was it de-emphasized, but it was looked down upon if you had those boundaries, especially when we're growing up. And so I think that's one of the reasons why it's so difficult. I find that, you know, Korea too, but I think that as Korean American children grow up, I think this boundary issue becomes one of the biggest struggles in their lives a lot of times, because what happens is that, yes, we grew up in a collective family unit where boundaries were not emphasized, where we don't learn how to recognize boundary, how to recognize it when it's violated, the more importantly, how to respond when they are violated, right? And then you go into the world, and the goal of immigration is for your children to navigate this world that is collectively American, right? It's not always Korean American. The world isn't, like your workspace isn't. So then in that workspace, you're at a disadvantage, where you're very likely to be taken advantage of your work ethics, or your things, or your merits. And how do you respond to that when you don't know how, unfortunately, how to navigate that political world.
Yes.
And I think that's where the resentment comes, and I have a lot of people who feel very confused about how do I, it's almost like code switching in a way, but how do you make amends with yourself where you are and feel comfortable in this space?
Yeah, I see that very often, especially at workplace. Usually the Korean or Asian Americans, we work very hard without complaining, without like really promoting ourselves and accomplishments. But then somehow, I mean, not somehow, it's very clear because of these lack of boundaries, and it's so hard for us to voice that. And I like the word respond when it's violated. It just, all the work lands on our desk, it seems like, and it just goes on. So, and even personally, when I was growing up, I feel like just naturally I am more keen to boundary setting. I know what I want and what I can and cannot agree to. So it was a little bit more defined for me personally. But the thing was, I've always been called selfish.
Yes.
너는 너밖에 몰라. 너는 what do you call it? Like I don't know, selfish in Korean, right? So that's the image, self-image that I had growing up. Oh, I'm a selfish person. But then I realized I wasn't trying to be selfish. I just was more clear than others about my boundaries. So what I noticed was, and also like other people have told me, is that the fear of being rejected or outcasted,
Or being not liked.
like it shapes our boundaries, like what that looks like and
Sure.
what it means. How does that work? What do you see?
Well, I mean, I think it's also partially like, so I think one of the things that we work on, we meaning like a lot of my patients and I are living the world as a you're centric. Like I always say like men, like I would say like you're living the men centric world, right? Doesn't
That
mean
sounds
that
bad.
it sounds bad. But isn't that true? I mean, like, I always talk about, on the airplane, you have to put your own mask on before you put everybody else's. So if you're syncing together, that's not gonna work, right? And if you're losing yourself in the collective society, then you're not really living the life. So when I say min-centric, it doesn't mean that you're only gonna be you, right? But everything starts with you, within you. Like you have a core. And then when you feel grounded, when you feel comfortable with yourself, when you feel confident about what your decisions are, how you feel, and the feelings that you feel, then you're able to look after others genuinely.
Yeah.
Right? Because you can do the action of taking care of each other. You can do the action because I think we all learned it's
Be nice.
Yeah, be nice. But that's not how relationships work. You have to be really genuinely caring for that person. What that means, and I learned this later in my life too, that I don't have to be caring for everyone. But I do want to care for those who really are in my world, Jang-centric world. And that world can expand or get smaller And you have to know that not everybody's going to be in one ring, right? There's going to be some people who are very close to you, and there's some people who are on the outskirts. And when you are thinking about others, you have to start from you and then go outwards. That's how I think about it. And so, yeah, min-centric is not a bad thing. I think that's how one should really fulfill your life. And I think this is really hard. Sorry. So, I mean, I think this is really hard because you are right. I think a lot of the older generation be like, well, you're just thinking about yourself. But if you really think about it, and I have a lot of younger patients, young adults will say like, oh, like I'm not taking care of mom, I'm not taking care of dad, and all this stuff. But, and you're a parent. I think in the end, what is the goal for parents, for your children? Like, yes, we have like all these expectations or hopes and wishes for our children, but at the end, I think when you strip all of that out, you just want your children to be healthy, happy, and if I add, a very productive part of the society.
Yeah.
And
Yes.
so to me, that's a long-term goal. And you have to look at that long-term goal and say like, okay, my parents might not be happy right now, but this is how I'm going to get to my goal.
Huh. That's very interesting. So maybe this is what I'm hearing. Maybe one tool for healthy boundary setting is thinking long term rather than just now. Can I make everybody happy?
That's right. Yeah, because you cannot make everybody happy.
Right.
Sometimes you can, and the only one that's not happy is you.
That is so true. I totally relate to that. As a mom, as a wife, as a person in the society, yeah, you could work for so hard and drive yourself to make everyone happy and appease everyone, but you're the one who's left behind, very unhappy and very resentful.
Yes. Yeah.
Very, very interesting. So you mentioned this a little bit. So for the young Korean Americans or Asian Americans, especially like any immigrant family, and for myself, I'm speaking for myself as well, the need for taking care of our elderly parents is greater, it gets greater by the day, right? And I know I spoke with a couple of young people in their 30s, and they're busy with their own life. They're trying to build their career, date, they're in that prime stage of their life. But they feel like the weekends are sucked in by their parents. They have to go over and do their bill payment, call the doctors. I mean, everything. Some said sometimes their parents will call them in the office and say, "Can you order me lunch?" Because these people cannot understand my English over the phone. So, it's very difficult. Like, how can we long term work through that? What can we do?
So, individually, it'll be different, right? And so, I think so I'm not talking about you have to cut your parents off completely. Well, okay. But I think you have to think about what you can take and what you cannot take. So, for example, I always talk about, well, people are like, well, how do I know, if someone is, my boundaries are violated? I don't know. My automatic, response is yes, I'll do it, or okay, I'll do it, right? Or with parents, both at work. Well, I was like, I answer, well, when you say that yes, and you turn around and you feel annoyed, then it's violated. Right?
So,
Because, you're not quite angry, or you don't have that response, but while you're doing the deed, you're like, "Ah, so annoying.
Mm.
That means it's been violated.
Mm.
So then I have to ask, well, so do you think it's harder to say no at the moment? Or is it harder when you feel that annoyed and those things piling up and you have to decide, right? What is gonna be your choice? I'm not saying you have to do one or the other,
Yeah.
but in each situation, that way you can learn where your boundaries are, right? So if you're like, you know what, I'll just do it and it's okay. Like I'm a little bit annoyed, but that's okay. That's the porous part of your boundary, right? Um, but if you're like, oh no, then I'll have to say no. And I have people who are like, at some point, in different parts of their lives, they can say yes to a lot of things, and then when things get stressed or they have a lot on your plate, then it tips over, and you're like, okay, now I have to say no, right? And it gets a little scary when you have to say no because you don't know how it's going to go. And that's when the long-term goal happens, right? So we have to kind of think about, well, yeah, no is always going to upset people,
Yeah.
right? But if they're upset now, are they going to upset long term? Are you going to be upset long term if you said yes? Then that's when the min-centric comes from. Long-term goal is for you to not feel resentful and be take joy in that relationship. So with parents, it is a little bit of balance, right? But you don't want to be left with like, I do everything for my parents and like this is such a chore and I don't really enjoy the relationship. Like, you should really love your mom and have actually enjoy the time together. Like if you go out to, I don't know, Starbucks, even if it's not like 2 hours, like couple 10 minutes of joyfulness, that's the relationship that you want to have. Then are there things that that you have to say no? Maybe not big things. Okay, yeah, like I will make the appointment to the doctors because that's very important. But maybe if mom calls or texts in the middle of your workday to talk about lunch, maybe your phone's on mute. Right?
Yeah.
Because you would do that to other people, wouldn't you? Like if someone, I don't know, your distant friend from high school is calling you and you're like, after 5 years, I'm going to let it go to voicemail. I don't have to take the phone call right now. So you're not ignoring them. But it's also kind of thinking about as kind of the change in perspective. So I'm not saying no because solely because I don't want to do it. Maybe they also have to learn how to do them, right? I'm giving them chance.
You're giving them a chance.
They don't like it, but what kid likes learning?
Yeah.
I don't like learning new things either.
Yeah.
But you have to do them.
Maybe I wasn't so American after all, because listening to that, I'm feeling this boiling feeling of guilt coming up inside of me. Not that I do cater to everything that my parents want or anybody else or even my children, but I think I do it with guilty feeling still. Like I say no with the guilt. So I tell myself, okay, I'm saying no because this is my boundary. I'm gonna respect my boundary, but there's that still guilt in me boiling, you know? Interesting.
Yes, the feelings of guilt, I think it's about kind of looking at the relationship and say, like, yes, I think it's in our society, relationship, especially family, with parents or children or even siblings, it's not just about love, but it's about obligation, right? And so the feelings of guilt, I think, comes from not feeling like you're not fulfilling your obligation as a daughter or sister or a mom, right? Um, right? But but you also have to think about the joy and obligation, right? You're gonna have obligations, but what happens when the relationship only becomes just obligation? That's not a real relationship you like. Even as a child, I mean, you don't want your parents to think of you as a chore, right? And so uh, it's two sides to that. And how do I navigate that?
That's pretty deep. That yeah, I'm digesting that. Especially the part about your children or even your parents don't want you to think of them as chores.
Yeah.
Huh. So Dr. Cho, when someone violates our boundaries, whether porous, flexible, or rigid, how do we respond? What is a good way to respond?
Well, what do you think happens a lot of times? People who haven't learned how to navigate these things and somebody's boundary gets violated, what happens? What are the responses?
The,
If your boundaries are violated.
I feel angry, rejected, misunderstood, and disrespected. Yeah.
So you either say nothing, or
Oh, the respond.
yeah,
I think depending on who it is and what the situation is. So, but I may say nothing, but it does come out in my actions or my facial expression or how I deal with it outwardly. But I think it always builds up inside.
yes. So a lot of times you're right. Like you said, you just don't say anything, but it comes out in different ways. Or people who have never really practiced these things sometimes will be very outwardly angry to the point where it's um, not proportional to the way that it's been done. And what happens is, especially in the workspace, right? Like, then you're the weird one, right?
Uh-huh, uh-huh.
Because you're getting really angry for nothing.
Yeah. What's going
Yeah,
on, right? Yeah.
right. So I think part of the learning process is how to let that person know gently that you have violated my boundaries, and I'm not gonna take that. But in a way that is not reactive, right? But also um, like the way that you want them to know that you're not supposed to do those things. So I think if, for example, I think one of the things, the easiest way example would be like racism, right? Or like where people are um, like where are you really from,
Yeah.
right?
I was thinking just that one.
And like you can either say, "Oh yeah, I'm from here and here," or and then get really angry afterwards, or like, oh, "What's wrong with you? Like, why do you say those things?" and get really angry. Or you can say, "What makes you want to ask that question?"
Hmm.
That's really not nice.
Go as far as that's really not nice.
Yeah,
Voice that.
that's actually really offensive. So the way that I talk, I'm not being reactive, but I'm telling you, I've been poked and I will poke you back, right? Because then the answer has to be on him or her,
Right.
and they will back out,
Yeah. Yeah.
right? I think those are small things that we don't always talk about in our households, right? especially because we have a hierarchy within the family system and things like that. But I think it's important skill that I think as an adult living in the society needs in order to protect oneself.
Give us another example of how we could respond in a healthy way without getting angry with our partners. How about that one?
With partners. Okay, what would be a good scenario? Let's see. Mm, well, I think with partners, it's a little bit different, right? You don't want to shoot back like that, right? Because it's a one-time, not racism. It's like you meet that person once and then it's gone, right?
True.
But with partners, I think maybe it's also it's something like along the lines like we talk about I statements, right, for young children, and so you start with how I feel, and it hurts my feelings when you know, take a make a cup of coffee and then not offer me one, right? Or you, you know, I feel like I'm being taken advantage of. So like starting with how I feel when this thing happens, right? So I'm not blaming you. This is how I feel, and you know, uh, I would like this to be not the case. So it's taking the blame out of the system, but telling you like this doesn't make me feel good, right? I do that with a lot of kids. We sometimes we practice when the little you know the first and second graders are talking to their friends, and I don't want to do this, or well you want to play this, but I don't want to play this. I feel lonely when you leave me out in the play. Uh, versus like, why do you leave me out? You're bad, right? You're being selfish. No, I feel left out. I feel lonely. There's a difference in terms of how that other person perceives it, because in the end, the goal of this conversation is to make the other person do certain things, right? Right? So it's not about like, I'm going to vent all my anger on you. It's about, okay, I want you to be able to understand that I want you to not do this.
And also suggest a way that would be helpful.
Yeah, I mean, it's very idealistic a lot of times, and people are like, how do you do that? But you just have to practice. And it's something that I think nowadays the school is teaching kids like die statements and things like that because it is a part of communication, way of communication.
It's really interesting. You know, I was listening or I read something by Brené Brown, very
Free Brown,
popular.
yeah.
And I think she says something about silence as a tool, silence as a boundary setting tool. What do you think about that? I thought that was really interesting.
That's the hardest for me.
Yeah, because you know, sometimes when you're not saying anything, you feel like you're being
Rude.
rude and also being passive. But she said it's a powerful, it could be a powerful tool.
Yes. Yes. I think it's right, like what is not said can be more powerful than what is said, right? And so I mean we can go back to that where you're from question, and you can, and it's about also how it's delivered, right? So when they ask you that, you can just look at them.
Just,
Yeah, and basically the ball is in their court to either they're gonna re-ask the question, or they're gonna say, "Oh, I must have done something
yeah,
not right."
backtrack a little bit and think about
Yeah.
their.
So I mean, these are helpful, but not always helpful with working with Asian parents.
Yeah. Why aren't you saying anything? What?
Yeah,
버르장머리
or like,
없이, right?
yeah, exactly. And so it's more subtle within the family for sure. Yeah.
So this is my question, and I think many people that I've asked about boundary setting had same sort of question. Okay, so like you said, we did not really grow up taught what boundary setting is, what that even is, what does it even look like. So we have really very little idea, and when we try to put some boundaries, even as an adult, you're always backfired with, oh, you're so, selfish and so self-centered and not considerate, rude, all these name calling. So how do we, as parents, grew up in this lingo of confusion? How do we teach our children what that means and what it looks like? How do we do it?
Well, I think it's not that hard because like we didn't grow up with it, but most of us, as especially 1.5 generation who are in, most of has gone through some schooling here and are in the workforce. And by nature of that, you've learned some. You may not recognize it as boundary setting, but like things like knocking on the door when you enter someone else's office, right? These are boundaries that these are social norms, right? But also boundaries of that person that I am uh, respecting. So if that's the case, can we do that with our children, right? And I think, and this is not just for Asian Americans. I think also, just all American moms and dads. I think it's an ongoing conversation about when my child says no, you respect that no, right? So, for example, even smaller things like there's the movement where when you go to visit family members' house and the adults want a kiss from the children, if the kid says no, it knows a no. So
Right.
that kind of respect, like learn. So it's not just about boundaries. It's about how to teach our children in a day-to-day out that your world is, you know, your centric, right? Like you're the most important thing to you. So that teaching them how to take care of themselves is the first thing. Then they, as they're growing and as they interact with other children in school, they're gonna learn how to do that. So, for example, I was dumbfounded. So, my daughter was maybe a 1 year old and she was in daycare. And she's very kind of docile in her demeanor to start with, her trait. And she had never been with other children before. So she was in this little tiny daycare. And what I was told is that she will hold a toy and then another kid will come and like take it. And she would just cry. She wouldn't even resist. She would just cry. So the daycare teacher, so what would we do? Like a lot of times, I think the reaction is, "Oh, you're sharing your toy, right?" No, this teacher taught her how to say mine, like mine,
Ah, okay.
right? So that's boundary,
Uh-huh.
right? For the little one, it's like I need to learn that this is mine before I can share.
Yeah.
And that was a concept that I was like, wow, like really? I can say it's mine?
Right. Yeah. That's so totally against everything that we know. Huh. Okay. Say
So
more.
yeah, so I mean, I think it's more just about kind of you have to learn to like what you have in order to like other things in other people. You have to be able to respect yourself so that you can respect others. We learn the other way around.
Yeah. So
But we
true.
don't have to. We don't have to take care of others while sacrificing ourselves. It is possible to take care of yourself and others at the same time. And I think that's something that we've been missing a lot.
Yeah. That's a huge shift in thinking. That's that's huge and very hard to grasp for a lot of people who grew up like me, because we're taught to share, be nice, be kind, play nice. Yeah, it's not yours. It's everyone else's. It's not You're not the most important. You're not to be self-centric. Yeah, you're for everyone else, and then maybe you. Huh. That is a hard concept to grasp, Dr. Cho. I think so. I think because a lot of people, we really struggle with that concept. Oh, and especially I think one of the questions that I got was, what about being kind? What about turning the other cheek? Because automatically, I think we associate setting boundaries with keeping everybody out, only protecting ourselves and my things and me, mine. So I think just like being more, like you said, porous and flexible, expanding is such a huge paradigm shift.
Yeah, I mean, I think what is a misconception is that when you're protecting yourself, it doesn't mean that you're going to go and hurt others, right? By you being you-centric doesn't mean that you're taking away someone else's centricness
Wow.
part, right? Everyone has their own space in order for us to share together. I think that's the different concept. I think it's difficult. I think it's kind of like a scarcity concept, right? Right? Like when you don't have a lot, then you have to share because if you take one, then no, somebody else doesn't have that one. But that's not how like relationship and boundaries work, right? It's not like there's three apples and we have to take, there's the more you invest in yourself, the more you can give to others, right? It, for example, I mean, I think we talk about like moms taking care of herself and things like that, but my kid doesn't like it when I go to the gym, right? Like it's a 1 hour less for her to play with me. But I tell her, you know what, like I need to work out because I need to be healthy for you, right? When she was younger, I wanted to be able to, my kid is really big. So I wanted to be able to hold her, but I need to make that muscle and be able to do that without aching anywhere. So it's a long-term goal, right? So if I'm missing that 1 hour, that's because I want to have quality time with you for the next 5 hours that I have.
Wow. I'm being wowed because coming into this conversation, I'm like, okay, I know what boundary is. Yeah, I know how to navigate through these things. I wanted to do it for other people. But hearing you really is challenging me, but not only that, it's like healing for me.
Oh, really?
Yeah.
Why?
You know, because you said the more you invest in yourself, you have more to give. And as a mom, as a mother, and all the other stuff that I am responsible for, that obligations, I think outwardly I was fighting against it. Like, okay, yeah, this is me, you know, me, I come first. Yes. But inside, I don't think I was actually relieved of that misunderstanding or misconception. But it almost feels like finally you're validating. So it's, and you know, because as you're a working mom, and there's so many feelings that comes with that. As are we really giving our best self to our children, to our family, all these things? It's an ongoing dilemma. So I really love the fact that you said long-term plan. And that's how we should look at each one of these relationships. And when you said those fences are not just one big one, but they're different, it reminded me of like Venn diagram,
Yes.
the old school.
Mm-hmm.
So yeah, it's mind shifting for me.
Mm-hmm. I'm
Yeah,
glad. Yeah,
yeah,
no.
this is really helpful. I'm so glad we had this conversation, or we're having this conversation. I have lots to think about.
These things don't change,
Mm,
overnight, and I have to work at it every day. And sometimes you lose some, sometimes you win some on Monday, and I think it's about moving with it, right? I, life just kind of develops and defines itself as you go. So I think part of it is also the boundaries that you set for certain people are going to change. If if I have my mom on mute during my working hours and it's fine, but maybe if there comes a time where she can't do any of these things anymore and I will have to be the emergency contact and I will not mute them. But you have to think about like what you can do to be that supporter for a long term, and what that means. So things can change and these are not set in stone and you have to move with it.
as a psychiatrist, mental health professional, do you think one tool, life tool or skill, that help people with healthy, healthy, healthy mindset or resilient mindset, maybe, is that flexibility, that knowing that you could be flexible over things? Because that's how I see it. Am I looking
I,
at it correctly?
I think so. I think you bring up a really good point that you're right. The flexibility ability. I think it's partially um, the growth mindset for sure, but also about adaptability, right? And things are not set in stone, and you can change. Things can change. I think that was really hard for me, especially with motherhood, is initially because I'm not very good with changes, and the kiddo just changes every day. Yeah, but also one of the things that was very helpful is I don't have to be perfect with these changes. This is my first time living as a mom, right? First time living as a daughter, and so kind of giving yourself grace too. That sometimes you can be rigid, and that's okay. Like I think just recognizing that there is a need for change, or recognizing that, oh, today I didn't do that, and that's okay. I think that's the most important thing.
The grace. Yeah, thank you for saying that. I think that gives a lot of people permission to be okay with that. being
I hope
being
so.
flexible, being not perfect, you know? And, yeah.
Yeah, I think we're taught to be super strict on each other, on ourselves, right?
Yeah, yeah.
Yeah.
So I'm curious at this. How did you get into psychiatry? You're an
Oh,
MD. You're an
yes, I
MD.
am.
Mm-hmm.
Yes.
Mm-hmm. So tell us about
Uh,
your journey.
oh, okay. So, I've wanted to be a physician for a long time, and then
Mm-hmm.
I did go to medical school, but I wasn't really interested in psychiatry. Um, so I actually went into surgical residency.
Mm-hmm.
And then I ended up stopping surgical residency around after about 2.5 years. So halfway through, because it's a 5-year program. And it that's when kind of life stopped. I had never not had a goal, and here I was like, I don't know what I want to do, what I really liked, and I took 2 years off. I was very Looking back, I'm very thankful that I was able to take 2 years off and that my parents were supportive. I didn't have a lot of pressure to do anything, and I ended up taking this tutoring job
Mm-hmm.
in Korea for SATs
Oh, okay.
because that's what pays really well,
Mm-hmm.
and I can do it. And I started working with a lot of third culture kids, right? Essentially Korean kids who go to school in America, and they're back in Korea for summer and doing SATs. And I really found working with them very rewarding, not just teaching, but kind of talking about their journey, talking about what their dilemmas were, a lot of the cross-cultural issues they were facing as young transitional kids of two different cultures. And so that's how I ended up really getting interested in psychiatry, especially because I think 10 years out, when I was in my 30s, when I was working with teens, and so it was almost like 15 years out, and the things that they were grappling with were very similar to what I was grappling with 15 years ago, and nothing had changed. And so that's how I ended up being very interested in child psychiatry. I ended up going back to residency um, and doing fellowship in child psychiatry. And I've had many different jobs, but I had my interest in working with international students, Asian Americans, immigrant families have kind of persisted, and that has really shaped my career in terms of working with free Korean American clinic, serving Asian American population. And so now I have a private practice that spans different cities, and my work heavily involves working with Asian American families, Asian American children, and also young adults.
Wow. I have to ask, so what are those things that the teens are grappling with, or and you have also? Can you share some of those?
There's many.
Yeah.
I mean, I think it's layers. So things that all teens of all countries talk about, like college, career, um, relationships,
Mm-hmm.
but also I think for these cross-cultural kids, it's also especially about identity,
Yeah.
um, relationship with parents, and how to navigate the bicultural, cross-cultural differences, and where am I in there, and where do I fit in? I think those are the kind of things that most people trying to figure out. In teens, it's all about kind of fitting in, and when
Yeah.
you don't fit in anywhere, how do you find your tribe?
Yeah. That is so difficult. That's such a journey, isn't it? Mm. What in your practice, working with bicultural children, teenagers, can you share with us one area where you see a lot of children or teens struggling with maybe with the bicultural? I guess that's the one large part that in this podcast that we're interested in talking about. What do you see? What do you recommend for the children and also for the parents? How do you navigate through that?
Well, I think there's a lot. We can talk about like pathologies that I see, but I think, and this is not just for teens, but for young adults and young professionals in their 20s and 30s, very successful people that I see. I think this ongoing dilemma of relationship with parents
Yeah.
is probably the biggest thing. I think it's a very difficult relationship because of, when you are even in a monolithic culture, there's a generational gap and age gap, right? In an immigrant family, there's a generational gap, but also age gap, but also cultural gap and language gap. And all of these things are very difficult. And a lot of the kids, they feel like what's left out of that relationship is expectations and responsibility, right? And that's why I keep on talking about, let's talk about joyful relationship instead of just the obligations, right? Finding that little joy in that relationship. And one of the things that, talking about like academic pressure and all these things, but to me, the most important thing for children, and I have a Korean American child, is to instill in our children that they are Korean American. They're American of Korean heritage. And this is a very difficult concept for some parents, especially first gen parents, because, and my parents too, and you go to school here and you go to work here, but you're Korean, right? And this is how Koreans are. I think that's where the biggest gap starts getting bigger and bigger.
Yes.
Because these children are not growing up Korean, they're growing up American, Korean American. And so, what does it mean to be Korean American? I think is the most important thing. The hardest thing, I think, is that when parents and the kids have a different identity, cultural identity, and for parents to not understand that there is a difference in how their children identify themselves from how they identify themselves, I think that's a difficult concept for Asians because of the collectivism, right? We're all the same. We're all part of each other. Whereas this is a very individualistic difference. It's subtle, but there's definitely differences, right? And how do you respect that? I think that's the most important thing that would help our kids of our generation to feel more solid and more core and loved the way they are.
Yeah. Yeah.
It's a lot.
It's a lot. I could go many different ways, and with that, it's yeah. As an immigrant child growing up in a very traditional family, I think I've only gotten comfortable with who I am as a person, not just even being Korean American or anything, just as a person, is when I finally felt okay with being different and in the between space.
Exactly. I think so. And I think that's a really hard place for teens, right? Or even young adults when
Yeah.
all they want to do is fit in.
Yes.
But you don't fit
Yes.
in one way or the other.
No, no. I mean, growing up in the 80s, what I heard was, you're Korean, you're not American. Imagine that dilemma in my head because everything else is American. We grow up as Americans, but then not really either. So you're like, okay, well then I hear one message, but then I have to output another type of message.
But
So,
why do you have to be Korean or American? Can you be Korean and American and be
Right.
Korean American, right?
Yes.
I think that's the concept that I think parents have to first embrace for the
Yeah.
kids to be able to
Yes.
learn that.
Yes, I agree. Yeah. Because it was almost as maybe they didn't mean to, but the message that I digested was it wasn't okay being Korean American. It
Right.
was you're Korean. Yeah.
Right. So how hard is that if you're within the
Yes.
family unit, if you're not Korean, you're othered. But if you go step outside,
Yep.
then you're Korean and you're othered. Right?
So the message that I hear over and over with other Korean Americans is that otherness. That otherness. How do we live with this otherness? The feeling of not being enough in either way. Well, and I'm so glad there are professionals as yourself that's working with the community, with those types of issues, and voicing and teaching and informing others about that very issue.
Well, I work in a very individual one-on-one settings a lot. But
Yes.
I think podcasts like this, I think, is very helpful because it is more accessible. Psychiatry is not, and so the more we talk about it in a more public forum, it's important for others to know these are the things that we're thinking about, and
Yes.
you're not the only one.
Yes, you're not the only one. It needs to be discussed. And yeah, when you hear others, it lets us know that we're not alone. We're not the weird one that felt this way growing up. Well, Dr. Cho, thank you so much for your time.
Thank you for taking the time and inviting me to this podcast. This was fun.
Oh, good. I'm glad. I like to have fun. Or maybe next time we could talk deeper about the Korean Americanness.
Okay.